My name is Cindy Landers. I moved here in 2017. When we moved to Spring Hill, we moved right across the street from the YMCA. In class one day in yoga, my knee locked up on me. I had to go see a doctor. I went to HCA Florida Oak Hill Hospital. He did some x-rays and he said, well, I have to tell you, you're bone on bone in your knee.
When she came to me with knee pain, we exhausted all conservative measures for that. Anti-inflammatory medications, physical therapy, exercises, medications, injections, the gels.
So finally I said, Dr. Higgins, I'd like to do the surgery.
I've been working with Dr. Higgins for over 20 years now. Bringing the patients into the operating room, they have to be there for them, and a lot of that is making them feel comfortable. From the time we take them in the pre-op area to the time they end up in our PACU waking up.
This is a journey that we embark on together. The surgery is only part of it, but it's a team effort, and using the physical therapist, home health nurses, most go home the same day.
Before the surgery, I would never have dreamed of sitting on my knees. I couldn't squat, I couldn't do any of those things. Now I can do all that. I really honestly surprised myself because I was so much stronger than I thought I would be. I could never say thank you enough.
She's a dynamic individual. She's very active at the YMCA. She's very physically fit. She does yoga. So she was like the perfect patient to bounce back quick. And no sooner did she get one done that she wanted to get the second one done. And she had two very positive outcomes, and she's really back in the game.
It's a wonderful feeling seeing patients and they tell you how well they've done. It's really why we're here. It's why we do what we do.
I was very impressed not only with Dr. Higgins, but also with HCA Florida Oak Hill Hospital. Everything that they did over there just went really well. Knowing that you have someone there for you means a lot.